Gauteng Premier David Makhura has now joined Gauteng Health MEC Bandile in Alexandra. It follows confirmation by the health department that one man from the township has tested positive for COVID-19. The man is said to have defied orders and travelled outside of the province last week to Limpopo, where tracer teams located him and forcibly placed him under isolation at a health facility there. Newzroom Afrika has verified that the infected case came from the densely populated area of Stjwetla. Senior politics reporter Ziyanda Ngcobo joins us live from Alexandra. Ziyanda, good morning. Of course, you've been monitoring developments in Alexandra throughout the course of these few days. And of course, I can see behind you there are health officials who are busy and hard at work. What are the latest developments?
Well, certainly, Gauteng Premier David Makhura has arrived here in Stjwetla. As I speak to you now, we're just on standby as the different groups get split up, of course, not trying to violate the regulations, which, of course, no groups bigger than 50, and also to ensure that they're able to maintain a decent level of social distancing. Behind me are the health officials here. They are prepping, of course, they're heeding the call that has been made by the President, indeed, that there will be massive screening and testing happening over the next few weeks. And I'm actually going to take you to the house where the man who is believed to have tested positive for COVID-19 is from, Mall of Africa. We understand from the briefing that was given to the Premier a short while ago that the people who lived with the man here have all also gone to Limpopo. So essentially the drive that is going to be done today by the Premier, of course, is strategic because, of course, we know that this man lived in this densely populated and formal settlement of Stjwetla. It's also going to be used as an education drive by the Gauteng Premier to actually encourage those living here to get tested. And of course, at the moment, we are being split into groups. We are waiting for the first group to move, and then we will follow thereafter. And then after that, of course, we'll continue going around. As you can see, it's quite difficult, to maintain, the 1.5 meter social distancing. And this is also reflective of the difficult conditions that healthcare workers often find themselves in. And so at this point in time, we know that, there's also a shortage of the mask that I'm wearing and the gloves. And I know there's also an appeal to citizens to really stay at home so that they can refrain from actually putting pressure on the healthcare system when it comes to protective gear.
Ziyanda, you have been in Alexandra for a few days now, monitoring the behavior and how people are adhering, or perhaps some not adhering to the guidelines set out by government officials. In terms of the reaction that you have received since the news broke of this man who has COVID-19, how has the general public in Alexandra reacted to the news?
Well, certainly this would naturally bring a sense of discomfort and, to an extent, panic in this community because of how close the houses are together here. And of course, you've just heard from Health MEC Dr. Bandile confirming that the number of people who've been placed under quarantine has increased from 5 to 9. So that's just an indication of how quickly it spread. But also, he even said in terms of how they'll be going about this screening, this mass screening and testing over the next week, as instructed by the President. He says they're going to use some sort of logical steps and processes, such as actually trying to figure out how many people this man came into contact with, which I think is actually going to be a very difficult task, given the fact that this man probably used public transport to go to Limpopo ahead of the shutdown. So it will be difficult to track down those people who might have been in that particular transportation at the time. But of course, we heard the MEC saying that he's satisfied with the manner in which the tracer teams have been operating, because they were able then to track down this man in Limpopo and put him under quarantine at a health facility in that particular province. So I think we're going to be seeing more of this taking place, not just in Stjwetla, but I guess where they believe are hotspot areas.
Just yesterday, Dr. MEC Lebogang Maile said that Alexandra is not a high-risk area. And of course, within a matter of hours, things had changed rather drastically there. Just in terms of the guidelines and the social distancing barriers that you speak of there, how are the community members expressing their challenges when it comes to social distancing and the reasons behind how it's almost really challenging to ensure that 1.5 meter distance that we speak of?
Well, when we interviewed the MEC yesterday, we were in a public space where there at least can be law enforcement authorities that can exercise a certain level of control. Where we were speaking was in the post office. And of course, they had anticipated, as per the plan, by the Social Development Department, that social grants would be released. So that one is a different case altogether. If you look at the situation that we are currently in Stjwetla, it's where people live, Limpopo. It's not easy to actually come and tell people how they should live if their homes are so close together. We don't know how many people are living in one particular shack at a particular time, Limpopo. So social distancing, when it comes to that, is not an easy task to actually exercise. I mean, it would then need authorities to literally go into people's homes to exercise that. And so this is the difficulty, I think, that has been expressed, and this is why we are seeing the Premier and the Health MEC and other officials coming out to actually go on an education drive of some sort here in Stjwetla, where that man did test positive. We know that this area is very densely populated, and as well as the fact that water and sanitation are very difficult in Stjwetla, and really this is part of the worry when you look at the preventative measures that need to be taken in terms of preventing coronavirus. Washing your hands for 20 seconds every 20 minutes. How is that going to happen in informal settlements such as this one, where water and sanitation are really scarce? You can see, I'm going to ask my colleague Senzo to show you, what the situation looks like. The hygiene in this area is not particularly the best as well. So really a tough situation, and I wonder how the Gauteng Premier is going to actually go about spreading this message, and whether or not there are any plans to relocate people. We know that for years, even when we're just talking about housing outside of COVID-19, we've heard, there have been many cries and protests over the years from residents in Stjwetla wanting to be moved, wanting governments to uphold their promises for housing. Perhaps then this would be a time to actually hear whether or not those plans will come into fruition, given the current circumstances that we find ourselves in.
Let's leave it there for now. Our senior politics reporter Ziyanda Ngcobo just covering the latest developments coming out of Stjwetla in Alexandra, where a man has tested positive. Of course, he has since been moved, and 9 people are under quarantine as we speak, in self-isolation, pardon me. And of course, an education drive out in full force there by health officials and government officials who are part of it. We will continue to check in on the latest developments across the many streets of South Africa, where our reporters are stationed in key areas, bringing you up to speed with the impact of the lockdown and COVID-19.